Thank you for taking time to explain the Better Care Closer to Home consultation to us today. Can you tell us what it's all about?
Yeah, so Better Care Closer at Home is, as it says, a proposal to provide better care closer to home for people. This is part of the larger 21C or 21st Century project we've been working on for some time in North Derbyshire, a project that brings together colleagues from across social care and the voluntary sector, as well as the NHS, to provide care in people's homes or as close to their homes as we can get them.
And why are you looking at these services in particular, and what services are you looking at?
So we're looking at particularly patients who currently have dementia and receive services from a community hospital, or patients with a physical health need who require inpatient care in a community hospital bed.
And why are you looking at those services?
Well, we know from talking to the general public over several years now that people want to be treated at home if at all possible. The phrase, "there's no bed like your own bed." We also know that actually staff want to look after people in that way, but we actually, most importantly, know that the national evidence suggests that it's the right thing to do. We know that people, when they stay in hospital for a long time, for too long, don't do as well. They're more likely to be admitted to long-term care or need long-term support. And we know that if we can avoid the need for admission, we can avoid those longer-term requirements.
And what are the proposals exactly?
So the proposals are, in terms of dementia services, to establish dementia rapid response teams. These are teams that will go into patients' homes and work with them in their own homes and support their carers. And over time, that will reduce the need for the beds that we currently have. So the proposals actually would see us not have the beds that we've currently got in Buxton and at New Home Hospital in Bakewell, but we would then focus our efforts and our expertise onto a highly specialist unit at Walton Hospital in Chesterfield. And again, that would allow us to provide a 24-hour on-call consultant service, both to support the ward, but also to support the dementia rapid response teams.
What will be the impact on the community hospitals?
So in the case of Bolsover Hospital and New Home Hospital in Bakewell, we feel that once the beds have gone, there's really very little left, and the proposal is actually to close the hospital site altogether, but only once we have relocated those services, which will continue. For the other community hospitals, they will stay open and continue to provide the rest of the services that they currently do.
And how can we have our say on these proposals?
So the public consultation runs from the 29th of June until the 5th of October. There are a number of public meetings and a number of smaller drop-in sessions. You can go to our website at joinedupcare.org.uk. You can also contact us by telephone or by post, details of which are attached to the end of this video.
Thank you, Dr. Milton.
Thank you.